The clinical trial has 3 steps, which are Phase 1, Phase 2, and Phase 3. Phase 1 lasts for 1.5 years. It takes a small group of people for testing. Around 20 to 100 volunteers are required. The main goal is to identify the safety and the maximum doses of drugs that should be administered. Phase 2 takes a longer time for completion, around 2 years. Around 100 to 500 volunteers are required. Doctors have to make a deeper analysis of the medicine based on a larger group. The main goal is to determine the efficacy and further evaluation of safety. The success in Phase 2 does not represent the success in Phase 3. Only 30% of medicine from Phase 2 passes the ultimate testing. Over 58% of drugs fail the tests in Phase 3. Phase 3 takes 3.5 years to complete. Around 1,000 to 5,000 volunteers are required. The main goal is to evaluate the efficacy of the new medicines. Participants are often randomly assigned to groups. Placebos are also used in some trials. These placebos are rarely used alone if there is an approved treatment. Doctors have to pay attention to ethical concerns. Participants have to fully understand the information. They should know the entire procedure, risks, benefits, and so on. They have opportunities to ask questions and withdraw at any time. The participants cannot be induced by the organization, such as the equivalent exchange. In the 1940s, African American men are involved in a syphilis experiment. They are poorly educated that do not even know that they are infected with the syphilis virus. In this experiment, the organization uses the lethal virus. It violates the principle of scientific validity. It also violates the principle of fair subject selection owing to the pure African American people. People of different ages and gender should all be selected. And lastly, for the placebo controls, not all clinical trials have placebos. Most Phase 1 and Phase 2 trials do not need a placebo control. Phase 3 trials do have control groups. The purpose of the placebo group is to reveal the comparisons between that group and people injected with the real drugs. Doctors will better understand the side effects of the drugs, and over 70% of placebo volunteers say that it is very useful to relieve their pain.